Welcome back to Drug Talk. In today's video, I'm going to quickly go over 3 things you should be aware of related to side effects of Midazolam. Number 1. Patients using Midazolam are at risk of experiencing somnolence or sometimes even excessive somnolence. In terms of percentages, about 1.2% of patients will experience somnolence, and 1.6%, so a little bit higher, will experience that excessive somnolence. Somnolence is a state of drowsiness or a strong desire to fall asleep. For many patients, the somnolence will subside over time as their body gets used to the medication, but for other patients, this side effect may persist. If you find this side effect, the somnolence, becomes troublesome and it starts to affect your activities of daily living, be sure to have a conversation with your prescriber and make a plan to move your treatment forward. They may decide to adjust the dose of midazolam that you're using or switch the medication to a different medication altogether. Because of the side effect, it's a good idea to be cautious after your first couple of doses of midazolam. Try not to do things like driving an automobile or operating heavy machinery until you have a good idea of how midazolam makes you feel. Number 2, a small percentage of patients using midazolam will experience headaches. About 1.5% of patients who use this medication will experience headaches. Like I mentioned with the somnolence, this side effect may subside over time, again as your body gets used to the medication, and it may not happen after every dose. Some tips to help reduce headaches in general would be to exercise, make sure you're getting plenty of sleep, do your best to manage stress, and reduce caffeine intake. Keeping a headache diary may be helpful in making sure that you have all the information necessary when you go to follow-up appointments with your prescriber to really help them make a plan for your treatment moving forward. And number 3, surprisingly, midazolam may cause hiccups. Roughly 4% of patients who use midazolam will experience hiccups. This isn't something that should be a concern for you unless these bouts of hiccups seem to last a long time. These hiccups may be induced by midazolam's effect on the supraspinal hiccup center in the brain. These midazolam-induced hiccups could also be caused by direct stimulation of midazolam on different respiratory muscles, specifically the diaphragm. Interestingly, in some situations, midazolam can actually be used to treat hiccups. Midazolam's central action, its anticonvulsant properties, as well as general sedation, may help reduce these hiccups. This is because it has a tonic depressant effects on striated muscle reflexes. This helps to reduce the number of hiccup episodes in some patients. That's it for today, but before you take off, I wanted to let you know you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on a link in the description of this video. Take care.